they're poisoned with cipro and prednisone, can the mitochondria recover? And if so, is it the same protocol of bringing safety back into the body and lowering systemic inflammation?
Well, the good news is I think most people do actually recover from as I say, being floxed, the
Yeah,
cipro, levofloxacin, and all those quinolone derived. Again, some people, the mitochondria are really poisoned, and it can take a few years till they recover. Okay, but usually, again, not everybody, but usually people do. Um, um, of course, all those things help in that issue. Sometimes intravenous phosphatidylcholine helps some people rebuild some of the cell membranes and help detoxify the quinolones. But that is a difficult thing because in some people it's just um, mild injury, and some people you really have affected the mitochondrial DNA, and that's where it can take a few years because you actually have to um, make new mitochondria, which you're always
right.
doing anyway. So working at mitochondrial regenesis is something to think about, and that's where looking into some of the things that maybe uh, increase apoptosis and increase knocking off cells that are injured and letting them
Hmm.
die completely so you can actually replace them
Yeah.
um, can be helpful.